My name's Adrian Richards, I'm a plastic surgeon, and in this short video I'm going to be talking about breast reconstruction with breast implants. So I've talked a little bit about in previous video about the reasons you may have a breast reconstruction and mentioned that it's normally after cancer or other problems such as infection or burns which can occur in the breast tissue. So implant reconstruction has the advantage of being relatively simple. The idea is that you lose the breast tissue and you reconstruct this with a breast implant, which may be placed under the muscle, because after you've lost your breast tissue, often your natural skin of your breast is very thin, and what we do need to make sure is that there's enough covering over the breast implant to give it enough cushioning. So your surgeon may well put your implant underneath either the pectoralis muscle and possibly the serratus anterior muscle, which is a muscle a little bit below that, to give more coverage to the implant. The advantages are it's relatively simple. It can be done at the time of your original surgery, a primary reconstruction, or it can be done as a delayed reconstruction. There are some problems with it, however. One of the problems is that obviously a breast implant isn't a natural body tissue. Often you may have radiotherapy if you have had breast cancer. Radiotherapy affects the blood supply to the breast area and can increase the risk of you developing a capsular contracture. Now, I've talked about capsular contractures in other videos, but essentially it's the breast becoming firmer because the lining, the capsule around the implant, becomes slightly more constricted and acts like shrink wrap around the implant. So breast implant reconstruction, although it's relatively simple, quick recovery period, does have some issues in that capsular contractures more common, and also it's not a natural body substance, so it won't act like a natural body substance over the years. Sometimes also you will need surgery to the other side of the breast. So a breast implant is going to restore the volume, but sometimes a secondary procedure, you may need a procedure on the other breast, maybe to lift it, maybe to reduce it, maybe to reduce the size of the nipple. And also at that second operation, you may have a nipple reconstruction, because often breast cancer operations remove the nipple during the mastectomy, and plastic surgeons now can perform nipple reconstruction to match the nipple on the reconstructed side. So in summary, breast implant reconstruction is simple, quick, good recovery, but things to be aware of: it is not your natural body tissue, it won't change with time like a natural body tissue, and there is a slightly higher rate of breast capsule formation and problems with the implant if you have a tissue which has had radiation to it. So thanks very much for watching the video. In the next in the series, I'm going to be talking about latissimus dorsi flap reconstruction, tram and DIEP flap reconstructions, and then finally a little bit about nipple reconstructions following breast cancer. Thanks very much for watching the video.